Hello, I am Mark Johnson, your educator here at YNS. Today's session covers a new set of NCLEX practice questions using our partner platform, Exam ASAP. Exam ASAP is an AI-powered question bank that adapts to your performance and provides audio rationales for efficient review, unlike anything you have seen before. For full access, see the description box below. Have your notebook ready and follow along as we strengthen your critical thinking skills. Without further ado, let's begin with question 1.
A 3-year-old child with Hirschsprung's disease is admitted for surgery. The parents express significant anxiety about the procedure and the potential impact on their child's future. The nurse notes that the parents have been asking repetitive questions and seem overwhelmed. What is the most appropriate nursing intervention to support the parents' mental health in this situation? Provide detailed medical literature about Hirschsprung's disease. Encourage the parents to express their feelings and concerns. Advise the parents to focus on the positive outcomes of the surgery. Refer the parents to a support group for families with similar conditions. The correct answer is B. Rationale. Correct answer B. Encouraging the parents to express their feelings and concerns is crucial in addressing their anxiety. This approach allows the nurse to provide emotional support and validate their feelings, which can help reduce anxiety and build trust. By actively listening, the nurse can also identify specific concerns that may need further clarification or support. This intervention aligns with the principles of therapeutic communication and supports the parent's mental health during a stressful time. Distractor rationales. A. Providing detailed medical literature may overwhelm the parents further and does not directly address their emotional needs. C. Advising the parents to focus on positive outcomes may dismiss their current feelings and is not supportive of their emotional state. D. While support groups can be beneficial, this is not the immediate intervention needed to address acute anxiety. Clinical tip: in situations where family members are anxious, using therapeutic communication techniques such as active listening and empathy can significantly alleviate stress and promote a supportive environment. A newborn with trisomy 13 is admitted to the neonatal intensive care unit with severe congenital anomalies, including cleft palate and a congenital heart defect. The infant is on continuous oxygen therapy and requires frequent suctioning. Which nursing intervention is most important to ensure the newborn's safety in the NICU? Here are the options. Option 1. A. Frequently reposition the infant to prevent pressure sores. Option 2. B. Ensure all suction equipment and oxygen tubing are secured and functioning properly. Option 3. C. Limit family visitation to minimize infection risk. Option 4. D. Maintain strict fluid intake and output monitoring. The correct answer is B. Rationale. Correct answer, B. Ensuring that all suction equipment and oxygen tubing are secured and functioning properly is crucial for this infant's safety. As the infant requires frequent suctioning, unsecured equipment could lead to dislodgement or malfunction, putting the infant at risk for respiratory distress or hypoxia. Reliable oxygen delivery is essential given the infant's congenital heart defect. Securing the equipment helps prevent potentially life-threatening interruptions in care. Distractor rationales. A. While repositioning is important, ensuring airway security and proper oxygenation takes precedence for immediate safety. C. Infection control is necessary, but maintaining critical equipment and oxygen supply is more immediately vital. D. Monitoring fluids is less urgent in this context compared to securing airway management tools. Clinical tip: always double-check the connections of life support equipment like oxygen and suction to prevent accidental disconnection, especially in critically ill neonates. A 16-year-old high school student has been referred to the school nurse due to significant changes in behavior over the past few months, including declining grades, withdrawal from friends, and frequent absenteeism. The student reports feeling overwhelmed by parental expectations and recent changes in the family dynamic, including a parental divorce. As the school nurse, which health promotion strategy would be most appropriate to support this adolescent's adjustment during this developmental stage? Here are the options. Option 1, A. Encourage involvement in a peer support group. Option 2, B. Recommend increased parental involvement in the student's daily activities. Option 3, C. Suggest the student focus exclusively on academic performance. Option 4, D. Advise the student to spend time alone to process emotions. The correct answer is A. Rationale. Correct answer, A. Encouraging involvement in a peer support group is appropriate as it provides the adolescent with a safe space to express feelings, gain support, and develop coping strategies from peers who may be experiencing similar challenges. This aligns with the developmental need for peer relationships during adolescence, aiding in emotional adjustment and social development. Engaging with peers can reduce feelings of isolation and promote resilience, which is crucial in managing adjustment disorders. Distractor rationales. B. While parental involvement is important, over-involvement can add pressure and counteract the adolescent's need for autonomy. C. Focusing solely on academics can exacerbate stress and does not address the underlying emotional needs. D. Spending time alone may increase feelings of isolation and does not provide the necessary social support. Clinical tip: peer support groups offer a powerful resource for adolescents dealing with life changes, facilitating both social interaction and emotional support development. A 55-year-old client with type 2 diabetes is admitted to the hospital for uncontrolled blood glucose levels. The client expresses feelings of frustration and hopelessness about managing their condition. Which nursing intervention is most appropriate to address the client's mental health needs? Here are the options. Option 1. Encourage the client to attend a diabetes education class. Option 2. Refer the client to a mental health professional. Option 3. Discuss the client's feelings and provide emotional support. Option 4. Adjust the client's insulin regimen to improve glucose control. The correct answer is C. Rationale. Correct answer, C. Discussing the client's feelings and providing emotional support is crucial in addressing the psychosocial aspects of managing a chronic condition like diabetes. This intervention helps the client process their emotions and can improve adherence to treatment by reducing feelings of hopelessness. Emotional support can also enhance the client's coping mechanisms and overall mental well-being. Distractor rationales. A. While education is important, it does not directly address the immediate emotional distress the client is experiencing. B. Referring to a mental health professional is beneficial, but does not provide immediate support for the client's current emotional state. D. Adjusting insulin may help control glucose levels, but does not address the client's psychosocial needs. Clinical tip: when managing chronic illnesses, always consider the emotional and psychological impact on the client, as these can significantly affect treatment adherence and outcomes. A 3-year-old child has been diagnosed with autism spectrum disorder, ASD. The parents express concern about their child's development and ask the nurse for advice on promoting their child's growth and development. Which of the following strategies should the nurse prioritize to support the child's developmental needs? Here are the options. Option 1. Enroll the child in a structured playgroup with peers. Option 2. Encourage the parents to use flashcards to teach new words. Option 3. Advise the parents to limit screen time to 2 hours per day. Option 4. Suggest the parents introduce a variety of foods to expand the child's diet. The correct answer is A. Rationale. Correct answer, A. Enrolling the child in a structured playgroup with peers is crucial for promoting social interaction and communication skills, which are often areas of difficulty for children with ASD. Structured playgroups provide a controlled environment where children can learn to interact with others, follow routines, and develop social cues. This approach aligns with developmental goals for children with ASD, focusing on enhancing social skills and reducing isolation. While other strategies may support development, peer interaction is a foundational aspect of growth in children with ASD. Distractor rationales. B. While using flashcards can help with language development, it does not address the critical need for social interaction and may not be as effective in promoting communication skills in children with ASD. C. Limiting screen time is a general recommendation for all children, but does not specifically address the developmental needs of a child with ASD. D. Introducing a variety of foods is important for nutritional health, but does not directly support the social and communication development needs of a child with ASD. Clinical tip: for children with autism spectrum disorder, facilitating social interactions in a structured environment can significantly enhance their communication and social skills, which are key areas of developmental focus. A 67-year-old client with a history of hypertension and recent knee surgery is admitted to the hospital with a suspected deep vein thrombosis, DVT, in the left leg. The client reports pain and swelling in the affected leg. The nurse notes the leg is warm to the touch with a noticeable increase in circumference. Which basic nursing care intervention is most appropriate to include in the care plan for this client? Here are the options. Option 1. Encourage ambulation to improve circulation. Option 2. Apply warm compresses to the affected leg to relieve pain. Option 3. Elevate the affected leg above heart level when in bed. Option 4. Massage the affected leg gently to reduce swelling. The correct answer is C. Rationale. Correct answer is elevating the affected leg above heart level helps reduce swelling and promotes venous return. In the case of a DVT, minimizing venous pressure in the affected limb is critical, as it can reduce discomfort and prevent further complications such as pulmonary embolism. Proper elevation supports the physiologic process of drainage without increasing the risk of thrombus dislodgement, which can occur with other interventions like massage. Distractor rationales. A. Encouraging ambulation might increase the risk of thrombus dislodgement, leading to a potential embolic event. B. Applying warm compresses can increase vasodilation and potentially exacerbate swelling or dislodge the clot. D. Massaging the affected leg can increase the risk of dislodging the clot, leading to an embolic event. Clinical tip: for patients with DVT, always ensure that interventions do not promote clot dislodgement. Elevation and gentle care are key. A 55-year-old male with dilated cardiomyopathy is admitted to the hospital for worsening heart failure symptoms. During your assessment, he expresses feelings of hopelessness and mentions that he is a burden to his family. His vital signs are stable, and he is compliant with his medication regimen. What is the most appropriate nursing intervention to address his psychosocial needs? Here are the options. Option 1. Acknowledge his feelings and explore his concerns further. Option 2. Encourage him to participate in a cardiac rehabilitation program. Option 3. Refer him to a social worker for financial assistance. Option 4. Increase his medication dosage to improve his mood. The correct answer is A. Rationale. Correct answer A. Acknowledge his feelings and explore his concerns further. This intervention is crucial as it addresses the patient's emotional state and provides an opportunity for him to express his feelings in a safe environment. By exploring his concerns, the nurse can better understand the underlying issues contributing to his sense of hopelessness and work collaboratively to develop a supportive care plan. This approach aligns with therapeutic communication principles and is essential in addressing psychosocial integrity. Distractor rationales. B. While cardiac rehabilitation can improve physical health, it does not directly address the patient's immediate emotional distress. C. Referring to a social worker may be beneficial for practical support, but it does not address the patient's current emotional needs. D. Adjusting medication without addressing the root cause of his feelings is inappropriate and outside the nurse's scope of practice. Clinical tip: when patients express feelings of hopelessness, it is vital to use therapeutic communication techniques to explore their emotions and provide support. This can help identify underlying issues and guide appropriate interventions. A 45-year-old client with narcissistic personality disorder is admitted to the psychiatric unit following a family conflict. The client frequently demands special treatment and becomes agitated when not given attention. During a group therapy session, the client interrupts others and insists on discussing their own achievements. What is the most appropriate nursing intervention to address the client's behavior during the session? Here are the options. Option 1. Acknowledge the client's achievements to prevent further agitation. Option 2. Redirect the client to focus on the group's topic and encourage listening. Option 3. Allow the client to continue speaking to avoid confrontation. Option 4. Ignore the client's behavior to minimize attention seeking. The correct answer is B. Rationale. Correct answer, B. Redirecting the client to focus on the group's topic and encouraging listening is the most appropriate intervention. This approach helps maintain the structure of the group therapy session and promotes the therapeutic goal of improving interpersonal relationships. It also sets boundaries for the client, which is crucial in managing narcissistic traits. By encouraging listening, the nurse fosters a more inclusive and respectful environment, which can help the client develop empathy and social skills. Distractor rationales. A. Acknowledging the client's achievements may reinforce narcissistic behavior and does not address the need for group cohesion. C. Allowing the client to continue speaking disrupts the group process and does not promote therapeutic goals. D. Ignoring the client's behavior may lead to escalation and does not provide guidance on appropriate social interactions. Clinical tip: when working with clients with narcissistic personality disorder, it's important to set clear boundaries and encourage behaviors that promote empathy and cooperation within group settings. A 68-year-old client with chronic lymphocytic leukemia is admitted to the hospital for chemotherapy. The nurse is preparing to administer the first dose of chemotherapy. Which action should the nurse prioritize to ensure the client's safety during this treatment? Here are the options. Option 1. Verify the client's identity using 2 identifiers. Option 2. Ensure the client is wearing a medical alert bracelet. Option 3. Review the client's dietary restrictions. Option 4. Check the client's vital signs before administration. The correct answer is A. Rationale. Correct answer A. Verifying the client's identity using 2 identifiers is a critical safety step to ensure that the correct medication is administered to the correct client. This practice helps prevent medication errors, which are particularly crucial in chemotherapy due to the high-risk nature of these drugs. Ensuring accurate identification aligns with the Joint Commission's National Patient Safety Goals and is a fundamental aspect of safe and effective care. Distractor rationales. While wearing a medical alert bracelet is important, it does not directly impact the immediate safety of chemotherapy administration. C. Reviewing dietary restrictions is important for overall care, but is not directly related to the safe administration of chemotherapy. D. Checking vital signs is important, but not the priority action for ensuring the correct client receives the chemotherapy. Clinical tip: always use 2 identifiers such as the client's name and date of birth, to verify identity before administering medications, especially high-risk ones like chemotherapy. An 80-year-old client with early-stage dementia is living independently and visits the clinic for a routine checkup. The client's daughter expresses concern about her mother's ability to maintain a healthy lifestyle. The client has a history of hypertension and is on medication. Which of the following interventions should the nurse prioritize to promote health maintenance in this client? Here are the options. Option 1. Encourage the client to join a community exercise class. Option 2. Discuss the importance of a balanced diet with the client. Option 3. Recommend regular cognitive stimulation activities. Option 4. Advise the client to monitor blood pressure daily. The correct answer is C. Rationale. Correct answer, C. Regular cognitive stimulation activities are crucial for clients with early-stage dementia to help slow cognitive decline and maintain mental function. Activities such as puzzles, reading, or memory games can enhance cognitive reserve and provide mental engagement. While exercise and diet are important, cognitive activities directly address the progression of dementia. Monitoring blood pressure is also important, but does not directly impact cognitive health. Distractor rationales. A. While exercise is beneficial for overall health, it does not specifically address cognitive decline in dementia. B. A balanced diet is important for general health, but does not directly target cognitive maintenance in dementia. D. Monitoring blood pressure is important for managing hypertension, but does not directly influence cognitive health in dementia. Clinical tip: incorporate cognitive activities into daily routines for clients with dementia to help maintain cognitive function and delay progression. A 35-year-old female client with polycystic kidney disease, PKD, is admitted to the hospital for management of her condition. She has been experiencing increasing fatigue and difficulty managing her daily activities. During your assessment, she expresses feelings of frustration and hopelessness about her chronic illness and its impact on her life. Which nursing intervention is most appropriate to address her psychosocial needs? Here are the options. Option 1. Encourage the client to join a support group for individuals with chronic kidney disease. Option 2. Suggest the client focus on dietary changes to manage her condition. Option 3. Advise the client to increase physical activity to improve energy levels. Option 4. Refer the client to a nephrologist for further evaluation of her condition. The correct answer is A. Rationale. Correct answer, A. Encouraging the client to join a support group for individuals with chronic kidney disease addresses her psychosocial needs by providing emotional support and a sense of community. Support groups can help clients share experiences, reduce feelings of isolation, and learn coping strategies from others facing similar challenges. This intervention directly targets her expressed feelings of frustration and hopelessness, offering a constructive outlet and potential improvement in her mental health. Distractor rationales. B. While dietary changes are important for managing PKD, they do not directly address the client's expressed psychosocial concerns. C. Increasing physical activity may help with fatigue, but it does not specifically address the client's feelings of frustration and hopelessness. D. Referring to a nephrologist focuses on medical management rather than addressing the client's psychosocial needs. Clinical tip: encouraging participation in support groups can significantly enhance a client's coping mechanisms and provide valuable emotional support, especially for those dealing with chronic illnesses. A 72-year-old client with a history of chronic renal insufficiency has been diagnosed with hypocalcemia. The nurse notes the client is confused and has a tingling sensation in their fingers. Which nursing intervention is the priority to ensure the client's safety? Here are the options. Option 1. A. Administer calcium supplements as prescribed. Option 2. B. Implement seizure precautions. Option 3. C. Encourage fluid intake to prevent dehydration. Option 4. D. Monitor for signs of infection. The correct answer is B. Rationale. Correct answer, B. Implementing seizure precautions is the priority nursing intervention for a client with hypocalcemia, particularly due to the associated neuromuscular irritability and increased risk of seizures. Ensuring the client's safety by preventing falls and injuries is crucial, which involves lowering the bed, padding the side rails, and ensuring suction equipment is available. While calcium administration is important for correcting hypocalcemia, immediate safety measures take precedence. Confusion and tingling are warning signs of severe hypocalcemia, necessitating immediate precautionary measures to protect the client. Distractor rationale. While administration of calcium supplements is essential for correcting hypocalcemia, it is not the immediate safety priority. C. Encouraging fluid intake is beneficial for chronic renal insufficiency, but it does not directly address the immediate safety risks associated with hypocalcemia. D. Monitoring for infection is important in chronic illness, but it does not address the acute safety issue posed by hypocalcemia. Clinical tip. In clients with hypocalcemia, be vigilant for signs of tetany, such as tingling or muscle spasms, which may indicate worsening condition and increased seizure risk. A 25-year-old client with schizophrenia is brought to the emergency department by family members who report that the client is experiencing increased agitation and paranoia. What is the nurse's priority intervention to manage this crisis situation? Here are the options. Option 1. Administer prescribed antipsychotic medication immediately. Option 2. Provide a calm and safe environment to reduce stimuli. Option 3. Engage the client in a discussion about their feelings. Option 4. Contact the client's psychiatrist for further instructions. The correct answer is B. Rationale. Correct answer B. Providing a calm and safe environment is the priority intervention in managing a crisis situation involving agitation and paranoia. Reducing environmental stimuli can help decrease the client's anxiety and agitation, creating a safer situation for both the client and healthcare providers. This approach also allows for further assessment and intervention. Distractor rationales. A. While medication may be necessary, the immediate priority is to ensure safety and reduce agitation. C. Engaging in discussion may not be effective during heightened agitation and could increase distress. D. Contacting the psychiatrist is important, but not the immediate priority in a crisis situation. Clinical tip. In crisis situations involving psychiatric symptoms, the first step is often to ensure a safe and calm environment to prevent escalation and allow for effective intervention. A 45-year-old male is admitted to the emergency department with a suspected brain abscess. He presents with severe headache, fever, and altered mental status. Which action should the nurse take first to ensure the patient's safety? Here are the options. Option 1. A. Administer prescribed antibiotics immediately. Option 2. B. Prepare the patient for an urgent CT scan. Option 3. C. Initiate seizure precautions. Option 4. D. Obtain a detailed history from the family. The correct answer is C. Rationale. Correct answer, C. Initiating seizure precautions is the priority action to ensure the patient's safety. Given the altered mental status and the risk of seizures associated with a brain abscess, This intervention helps prevent injury during potential seizure activity, which is a critical safety concern in this scenario. Distractor rationales. A. While administering antibiotics is important, ensuring immediate safety through seizure precautions takes precedence. B. A CT scan is necessary for diagnosis, but does not address the immediate safety risk of seizures. D. Obtaining a history is important, but not the immediate priority when addressing potential seizure risk. Clinical tip: in cases of neurological compromise, always prioritize interventions that address immediate safety risks, such as seizure precautions, to prevent injury. A 65-year-old client with a history of basal cell carcinoma is admitted to the hospital for surgical excision of a lesion on the nose. During the preoperative assessment, the nurse notes that the client is anxious about the procedure and expresses concern about the risk of infection. Which nursing intervention is most appropriate to address the client's concerns about infection control and ensure a safe care environment? Here are the options. Option 1. Explain the importance of hand hygiene and ensure all staff adhere to it. Option 2. Provide the client with a pamphlet on skin cancer prevention. Option 3. Reassure the client that antibiotics will be administered post-operatively. Option 4. Encourage the client to discuss their anxiety with the surgeon. The correct answer is A. Rationale. Correct answer A. Explaining the importance of hand hygiene and ensuring all staff adhere to it is crucial in preventing infections, especially in surgical settings. This intervention directly addresses the client's concern about infection control by involving them in the process and reinforcing the hospital's commitment to maintaining a sterile environment. Hand hygiene is a fundamental practice in infection prevention, and educating the client empowers them to be active participants in their care. This approach aligns with the principles of creating a safe and effective care environment. Distractor rationales. B. Providing a pamphlet on skin cancer prevention does not directly address the client's immediate concern about infection control during their hospital stay. C. While antibiotics may be part of post-operative care, reassurance about their use does not address the client's concern about infection prevention during the procedure itself. D. Encouraging the client to discuss anxiety with the surgeon is important for emotional support, but does not specifically address infection control concerns. Clinical tip: involving clients in infection control practices, such as hand hygiene, not only reassures them, but also promotes a culture of safety and accountability in healthcare settings. A 6-month-old infant is brought to the clinic during RSV season. The nurse is conducting a screening to assess the risk of respiratory syncytial virus infection. Which factor should the nurse prioritize in this screening? Here are the options. Option 1. The infant's birth weight. Option 2. The infant's exposure to tobacco smoke. Option 3. The infant's vaccination history. Option 4. The infant's dietary intake. The correct answer is B. Rationale. Correct answer B. Exposure to tobacco smoke is a significant risk factor for respiratory syncytial virus, RSV, infection in infants. Tobacco smoke can impair respiratory health and increase susceptibility to infections like RSV. During screening, identifying environmental factors such as smoke exposure is crucial for implementing preventive measures and educating caregivers on reducing risk. Distractor rationales. A. Birth weight is less relevant in the context of RSV risk compared to environmental exposures. C. While vaccination history is important, there is no vaccine for RSV, making smoke exposure a more immediate concern. D. Dietary intake does not directly influence RSV risk as much as environmental factors like smoke exposure. Clinical tip: educate parents on the importance of a smoke-free environment to protect infants from respiratory infections like RSV. A 25-year-old client with a history of epilepsy is admitted to the hospital after experiencing a generalized tonic-clonic seizure at home. Upon assessment, the nurse notes that the client is disoriented and confused. The nursing care plan includes implementing seizure precautions. Which nursing action is most appropriate to ensure the client's safety in the hospital setting? Here are the options. Option 1. Pad the side rails of the client's bed. Option 2. Place the client in restraints to prevent injury. Option 3. Keep the client in a wheelchair to prevent falls. Option 4. Administer an extra dose of anti-epileptic medication. The correct answer is A. Rationale. Correct answer. A. Padding the side rails of the client's bed is an appropriate and effective measure to prevent injury during a seizure. This intervention is part of basic seizure precautions and ensures that the client does not injure themselves against the hard surfaces of the bed during a seizure event. It demonstrates an understanding of physiological integrity by prioritizing safety and preventing harm. Distractor rationales. B. Placing the client in restraints is inappropriate and may cause additional stress or injury during a seizure. C. Keeping the client in a wheelchair is not practical. It does not prevent injuries during a seizure and limits their mobility when not seizing. D. Administering an extra dose of medication without a physician's order can be dangerous and is not a standard seizure precaution. Clinical tip: always ensure the environment is safe for clients with seizure disorders by removing potential hazards and implementing seizure precautions like padding side rails. A 65-year-old male client with a history of type 2 diabetes presents to the hospital with shortness of breath and swelling in the lower extremities. His vital signs include BP 160 92 millimeters of mercury, HR 110 BPM, RR 24 minutes, and SpO2 88% on room air. What is the priority nursing intervention? Here are the options. Option 1. Administer oxygen via nasal cannula. Option 2. Prepare for intubation. Option 3. Administer a diuretic as prescribed. Option 4. Check blood glucose level. The correct answer is A. Rationale. Correct answer A. Administer oxygen via nasal cannula. In this scenario, the client is experiencing shortness of breath and hypoxemia, as indicated by the SpO2 of 88%. Administering oxygen is the immediate priority to improve oxygenation. While preparing for intubation, B, might be necessary if the condition worsens. It is not the first intervention. Administering a diuretic, C, may help reduce fluid overload, but it does not address the immediate issue of low oxygen levels. Checking blood glucose, D, is important in a diabetic client, but is not the priority intervention in this case. Distractor rationales. B. This option is incorrect because preparing for intubation is not immediately necessary unless the client's respiratory status deteriorates significantly. C. This option is incorrect because while diuretics may alleviate fluid overload, the immediate concern is hypoxemia. D. This option is incorrect because checking blood glucose does not address the client's respiratory distress. Clinical tip: always prioritize interventions that address airway, breathing, and circulation, ABC's issues in acute care settings. A 28-year-old new mother, 4 weeks postpartum, presents to the community health clinic with her partner. She reports feeling overwhelmed, tearful, and unable to bond with her newborn. She also mentions having difficulty sleeping even when the baby sleeps, and feeling guilty about not being a good mother. Her partner expresses concern about her lack of interest in activities she used to enjoy. Which nursing intervention is most appropriate to address her postpartum depression? Here are the options. Option 1. Encourage the mother to join a new mother's support group. Option 2. Advise the partner to take over all childcare duties. Option 3. Suggest the mother increase her physical activity to improve mood. Option 4. Refer the mother to a mental health professional for evaluation. The correct answer is D. Rationale. Correct answer, D. Referring the mother to a mental health professional for evaluation is the most appropriate intervention. Postpartum depression is a serious condition that requires professional assessment and potentially therapeutic intervention. A mental health professional can provide a comprehensive evaluation and develop a treatment plan, which may include therapy or medication. This approach addresses the underlying mental health needs and supports the mother's recovery, ensuring both her well-being and the well-being of her child. Distractor rationales. A. While support groups can be beneficial, they are not a substitute for professional mental health evaluation and treatment. B. Advising the partner to take over all childcare duties may not address the mother's mental health needs and could increase feelings of inadequacy. C. Increasing physical activity can help improve mood, but it is not a primary intervention for postpartum depression and does not replace professional evaluation. Clinical tip: postpartum depression affects approximately 10 to 15% of new mothers. Early identification and referral to mental health services are crucial for effective management and recovery. A 68-year-old client with chronic respiratory failure is admitted to the hospital for exacerbation of symptoms. The client expresses feelings of frustration and helplessness due to their dependence on supplemental oxygen and limited mobility. The client also mentions feeling isolated from family and friends. What is the most appropriate nursing intervention to address the client's psychosocial needs? Here are the options. Option 1. Encourage the client to participate in a pulmonary rehabilitation program. Option 2. Arrange for a family meeting to discuss the client's care plan. Option 3. Refer the client to a support group for individuals with chronic respiratory conditions. Option 4. Provide education on energy conservation techniques. The correct answer is C. Rationale. Correct answer C. Referring the client to a support group for individuals with chronic respiratory conditions addresses the client's feelings of isolation and helplessness by providing social support and a sense of community. Support groups offer a platform for sharing experiences and coping strategies, which can improve mental health and emotional well-being. This intervention directly targets the client's expressed psychosocial needs, unlike the other options, which focus more on physical health or family involvement. Distractor rationales. A. While pulmonary rehabilitation can improve physical health, it does not directly address the client's feelings of isolation and helplessness. Arranging a family meeting may help with care planning, but does not specifically address the client's need for peer support and social interaction. D. Education on energy conservation is beneficial for managing physical symptoms, but does not address the client's psychosocial concerns. Clinical tip: when addressing psychosocial needs, consider interventions that enhance social support and community connections, especially for clients with chronic conditions. A 10-year-old child with muscular dystrophy is admitted to the hospital following a respiratory infection. The child's parents express feelings of helplessness and anxiety about managing their child's condition at home. What is the nurse's priority intervention to address the family's psychosocial needs during this crisis? Here are the options. Option 1. Provide detailed education on managing respiratory infections at home. Option 2. Arrange a meeting with a social worker to discuss community resources. Option 3. Encourage the parents to join a support group for families with muscular dystrophy. Option 4. Facilitate a family meeting with the healthcare team to discuss care plans. The correct answer is D. Rationale. Correct answer, D. Facilitating a family meeting with the healthcare team to discuss care plans is the priority intervention. This approach addresses the immediate crisis by providing the family with a clear understanding of the child's condition and care needs, reducing anxiety and feelings of helplessness. It also ensures that the family is actively involved in decision-making and planning, which can empower them. While other options are beneficial, the family meeting directly addresses the crisis by providing comprehensive support and information. Distractor rationales. A. Education on managing infections is important, but does not address the immediate psychosocial crisis. B. Community resources are valuable, but may not provide the immediate support needed during a crisis. C. Support groups are helpful for ongoing support, but do not address the immediate need for a coordinated care plan. Clinical tip. Involving families in care planning and decision-making can significantly reduce anxiety and improve their ability to manage chronic conditions at home. An elderly client in a community clinic with chronic kidney disease, CKD, stage 4, reports experiencing muscle cramps and fatigue. Recent labs show potassium 5.8 milliequims per liter, calcium 7.9 milligrams per deciliter, and phosphate 5.5 milligrams per deciliter. What dietary advice should the nurse prioritize? Here are the options. Option 1. Avoid high potassium foods. Option 2. Increase calcium-rich foods. Option 3. Limit phosphate intake. Option 4. Consume more protein. Option 5. Reduce sodium intake. Rationale. Correct answers: A, B, C. A. Avoid high potassium foods to prevent hyperkalemia complications. B. Increasing calcium-rich foods can counteract low calcium levels. C. Limiting phosphate is crucial since the client has hyperphosphatemia, common in CKD. Distractor rationales? D. Higher protein intake is not advised in CKD due to risks of worsening kidney function. E. While reducing sodium is generally beneficial, it is not the immediate priority compared to managing calcium, potassium, and phosphate levels. Clinical tip. In CKD, managing electrolyte imbalances through dietary modification is essential to prevent complications like cardiac arrhythmias and bone disease. A 75-year-old resident in a long-term care facility has a history of chronic kidney disease. He presents with confusion and a serum potassium level of 6.5 milliequivalents per liter. What is the immediate nursing intervention? Here are the options. Option 1. Administer calcium gluconate. Option 2. Increase dietary potassium intake. Option 3. Prepare the resident for dialysis. Option 4. Monitor urine output closely. The correct answer is A. Rationale. Correct answer A. Administer calcium gluconate. In cases of severe hyperkalemia, administering calcium gluconate helps stabilize the cardiac membrane and reduces the risk of life-threatening cardiac arrhythmias. Increasing dietary potassium intake, B, is contraindicated. Preparing for dialysis, C, is a longer-term solution and not immediate. Monitoring urine output, D, is important but does not directly address hyperkalemia. Distractor rationales. B. This option is incorrect because increasing dietary potassium is contraindicated in hyperkalemia. C. This option is incorrect because while dialysis may be necessary, it is not immediate. D. This option is incorrect because although monitoring urine output is important, it does not address the acute problem. Clinical tip. In hyperkalemia, prioritize interventions that protect the heart from the effects of elevated potassium levels. A 10-year-old child with a history of asthma is visiting the clinic for a routine checkup. The nurse is discussing lifestyle choices and self-care strategies with the child and their parent. Which of the following is the most appropriate recommendation to promote the child's health and development? Here are the options. Option 1. Encourage the child to participate in high-intensity sports to improve lung capacity. Option 2. Advise the child to avoid all physical activities to prevent asthma exacerbations. Option 3. Recommend the child engage in regular and moderate physical activities like swimming. Option 4. Suggest the child use their rescue inhaler daily as a preventive measure. The correct answer is C. Rationale. Correct answer, C. Engaging in regular, moderate physical activities like swimming is beneficial for children with asthma. Swimming is often recommended because the warm, humid environment of the pool can help reduce asthma symptoms. Regular exercise can improve lung function and overall fitness, which is crucial for growth and development. It also helps in building self-esteem and social skills, which are important aspects of a child's development. Distractor rationales. A. High-intensity sports may trigger asthma symptoms and are not recommended without proper management and supervision. B. Avoiding all physical activities can lead to poor physical fitness and social isolation, negatively impacting growth and development. D. Using a rescue inhaler daily as a preventive measure is not appropriate. It should be used for acute symptoms only. Clinical tip. Encourage children with asthma to participate in regular physical activities, as it can improve lung function and overall health. Always ensure they have an asthma action plan in place. A 45-year-old office worker presents to the clinic with complaints of low back pain that has persisted for the past 3 months. The client reports spending long hours sitting at a desk and has a sedentary lifestyle. As part of a health promotion plan, which intervention should the nurse prioritize to address the client's low back pain and promote overall well-being? Here are the options. Option 1. Recommend daily stretching exercises and ergonomic adjustments to the workspace. Option 2. Advise the use of over-the-counter pain medication as needed. Option 3. Suggest the client take frequent breaks to walk around the office. Option 4. Encourage the client to enroll in a weightlifting program to strengthen back muscles. The correct answer is A. Rationale. Correct answer A. Recommending daily stretching exercises and ergonomic adjustments to the workspace is the most effective intervention for addressing low back pain in this scenario. Stretching helps improve flexibility and reduce muscle tension, while ergonomic adjustments can prevent strain from prolonged sitting. This approach not only targets the immediate issue of low back pain, but also promotes long-term musculoskeletal health and prevents future injuries. Encouraging these changes aligns with health promotion by addressing lifestyle factors contributing to the client's condition. Distractor rationales. B. Why pain medication may provide temporary relief. It does not address the underlying causes of low back pain or promote long-term health. C. Taking frequent breaks to walk is beneficial, but does not directly address the ergonomic factors contributing to the client's pain. D. Weightlifting can be beneficial, but without proper guidance, it may exacerbate back pain. It's not the first priority in this scenario. Clinical tip. Encourage clients with sedentary jobs to incorporate regular stretching and ergonomic assessments into their routine to prevent musculoskeletal issues.
Okay, everyone, that was it for today's question bank. At the end of this tutor mode, you will get the score and all the rationale details here. Check out our test bank platform, Exam ASAP, our advanced adaptive testing platform featuring over 5,000 peer-reviewed questions designed to mirror the NCLEX experience. It includes detailed rationales, daily content updates, and a 24/7 AI tutor, resources recognized as industry-leading and proven to enhance your performance. Not only that, our question bank platform has next-generation NCLEX question types with case studies. We are adaptive and AI-powered platform that allows you to pass the NCLEX the first try. And don't forget to check out our ultimate NCLEX mastery notes at yournursingspace.com. While you're there, explore all our other free guides and study notes available to support your NCLEX journey. So check out our website for all those goodies. And I hope this lecture helped you feel a bit more confident, whether you're studying for nursing school or gearing up for the NCLEX. Again, I'm Mark Johnson, your NCLEX instructor here at YNS, and I'll see you in the next lecture.